So low testosterone symptoms typically include lower levels of energy. Usually guys feel like they're run down in the afternoons. Just they don't have the same drive that they used to want to get up and initiate. They want to get home and just sit on the couch more. Okay. And it's a very subtle thing typically. It's just guys find that maybe a few years ago, I used to be doing these activities and now I don't. That's probably the most predominant, lower levels of energy and drive. Testosterone's tied into your metabolism, so whenever you boost your metabolism, it gives you more energy and just vitality in general. It's after the age of 30 is when we have this age-related decline in testosterone. Okay. No doubt guys in their 20s could have lower levels of testosterone, but it is more rare. It's usually not age-related declines, usually due to some other factor. And it's 30s is kind of a gray area. Some guys will have higher levels still, and some guys will be slowing down. Most of the guys, by the time they reach the age of 40, have slowed down on their testosterone. This testosterone replacement therapy is an FDA-approved therapy that has been approved for over 50 years. It was just in the 80s, during the era of bodybuilding, when that was started, that people started abusing it. And then they started dying of strokes and heart attacks because no doubt one of the dangers when you go beyond normal physiology or beyond what the body would ever produce as far as testosterone, it can't handle it. So it breaks down all that excess testosterone into its fundamental components, one of which is cholesterol, which is no good, and that's why you hear of guys who are abusing it, the bodybuilders dying of strokes and heart attacks because they're clogging up the arteries. Studies actually show if you're at the higher level of the normal range, high levels of normal physiology, your body can handle it, and testosterone is tied into your metabolism. So it boosts your metabolism, and it actually lowers your total cholesterol and has positive cardiovascular benefits because of that. The largest study ever done on testosterone replacement therapy by the VA hospital system, there's 83,000 participants. It all shows that everyone's risk of strokes and heart attacks and blah, blah, went down. So it just needs to be done the right way. As long as you're using good FDA-approved medications, because you know exactly what's inside of that vial. A lot of the black market has precursor hormone into it, so they have to take twice as much by volume just to get to the same amount of testosterone level. So as long as you're using good FDA-approved medications, you're being blood monitored by a physician, this is now just considered innovative preventative medicine. One of the great things about the Man Clinic here is that we're one of the only clinics in LA. I think we are the only clinic in LA that has an in-house laboratory, CLIA certified lab. So we get testosterone results within about 20 minutes. Total testosterone is what's needed to look at the total production of what the testicle cells are producing. We rule out prostate cancer with a PSA test as well, and that also takes about 30 minutes, but what's great is when you do come to the Man Clinic, we can get your results here the same day and get you the consultation so you can understand whether you're a candidate or not.